Hello, my name is Anna Lopez, and I'm going to be giving you a small demonstration on touch time infant massage. This specific technique is going to be for the baby's belly to help with any kind of constipation or gassy or colicky symptoms that the child may be having. First order of business would be to disclose that I am certified in infant massage. I was been certified for about over a year now. I want to say it's been about a year and a half. I was trained by Elaine Fogel-Schneider. She's PhD. She is one of the country's leading experts on baby massage and is a certified instructor and trainer of the touch time infant massage techniques. She's a wonderful woman. We were actually trained specifically from her. And she did really great job. So I kind of wanted to go into the importance of touch for a baby. Not only does it create a stronger attachment with the child, it creates that connection between you and the child, and touch is so necessary to nourishing the baby's brain. Not only does it release the feel-good hormones like serotonin and oxytocin, but it also releases the stress-causing hormones like cortisol and epinephrine, which is like adrenaline. Those chemicals can be more harmful to the baby and can hinder the brain development. So the importance of touch is just astounding. It's amazing how much growth these children can get from just the touch. Dr. Elaine was explaining to us that touch is necessary as much as air and water is to our bodies. Before we begin, I want to give you guys a little bit more information on the oils that you can use when massaging the child. You want to avoid things like baby oil and regular lotions because those are too slippery and then they're sticky. So all natural type of oils like flaxseed oil, apricot oil, mango oils, things like that, where they are slick, but they're enough that it'll absorb into the baby's skin. You do want to avoid any kind of seed oils if the child has any kind of allergies to like peanuts and things like that. One of the first disclosures that I want to give is that infant massage is not for everybody. If the babies have any kind of acute illnesses or diseases such as cancer, you cannot do these types of techniques on them. It can actually harm them more. So the first thing you want to do is to check with the baby's primary healthcare practitioner to make sure that it is acceptable to offer the massage for your baby. There are several medical conditions that are contradictory to massage, and you should never massage your baby when they apply. Some of the things that you don't want to do infant massage on your child is if they have a high fever, if they have an acute infection, have a skin disease from a skin disorder or a contagious disease or inflammation, has had recent immunizations. You want to wait about 24 to 48 hours, and you don't want to massage too hard or apply pressure to the area where the child was given the shot. If there's any kind of abdominal difficulties, you want to avoid that as well. If there's any life-threatening medical conditions, if the baby still has the knot from the umbilical cord, then you want to wait approximately 2 to 3 weeks for the end of the umbilical cord to fall off before beginning massage. That area is definitely an area that you want to keep dry and is still tender. If there's any kind of swollen lymph nodes, then you want to avoid that as well, and any blood conditions such as blood clots. Again, you definitely want to get permission from your doctor prior to the start of any kind of infant massage techniques. So for the training, we're going to be using baby Emma. This is my massage doll. You have the choices of doing the massage on a bed. You could also use the pillow to elevate your child. So you would just lay them up on the pillow like this. If you want to elevate them, you can do it on the floor with a blanket and pillows as well, or on a sofa, same thing. This is one of the oils that I usually use. I like to use grapeseed. Again, it's a skincare oil. It has the vitamin E. It's all natural. so it absorbs into the baby pretty well. When you put it on, you're just going to put a little bit into the palm of your hand and you're going to rub it together. But when you're rubbing it, you want to rub it next to the baby's ears. So if you can hear it, that sound is reminding the baby of when it was in the womb. So when you're rubbing it, you're letting him know it's massage time, or her. So then every time you go to do the massage and you make that sound, it's reminding them that it's massage time and they look forward to the massage. So before we actually begin the massaging, we're going to do the ABCs. The first one is called attuning, the second one is breathing, and the third one is communicating. So I kind of want to skip to the breathing part because it's really important that the caregiver is calm and that you don't have any stress going on before you start it, because the babies could feel that. So we want you to take at least 5 deep breaths, which is breathing in through your nose and out through your mouth. Some nice deep breaths. Do about 5 of those before you begin. So when we go to start, again, it's going to be the ABCs, and then we're going to go into D and E and F, and then the other part of the techniques are all going to be assigned a letter. So the first one that we're going to do is called attuning. So the A is for attuning, and attuning is getting a connection with you and your child or the baby. The first one is going to be, you're going to do some small little rubs on the face. You're going to make good eye contact with the baby. You're going to be smiling at the baby. Hi, baby Emma. And you're going to be talking to the baby. So what this is doing is it's creating the connection between you and the child. The second one is the breathing. So again, you want to make sure that you're taking good deep breaths while you're doing the techniques, so that way you're relaxed and the baby is relaxed. The third one is C, for communicating, and you want to ask permission of the baby. Are you ready for your massage? Of course, they're not going to say yes or no, but it's just getting them permission so that way you're not just intruding on their space. The D is for daddy long legs. So for this one, you're going to be at the level of the belly button, and you're going to go from 9 o'clock to 3 o'clock using a sweeping motion like this with your fingers. You're going to apply pressure, not too hard, but a slight pressure down, and you're going to sweep, and then you're going to move your fingers, and what you're doing is you're going to be pulling out any gas that is inside of the baby's stomach. So you're going to start from here, and you're just going to push the pressure, and you're going to keep going. And you want to try not to lift your fingers too much, because then that'll let bubbles go back. So as you're sweeping across, you're pushing those bubbles out as the intestines go in this direction. So any kind of techniques that we're using on the belly will be going to the right, or it will be clockwise on this side. Anything on the back of the baby will be counterclockwise. The E is for Earth Watch. So for this one, you're going to place your right hand at your baby's navel and tummy. So it's going to be right above the leg, but on his belly. The left hand you're going to place right above it. What you're going to do is you're going to move in a clockwise position, and you're going to rub your hands firmly over the baby's tummy, circling around like it's the shape of the earth. You're not going to lift your hands up during this time, and you're just going to keep going around about 3 to 4 times. If your baby is agreeable, you can alternate doing a circle with the Earth Watch with the daddy long legs that goes across. And you could do those about 3 to 4 times. So for F, we're going to do fun galore. There are 2 different ones. One is legs down low, and one is legs up high. For legs down low, you're going to have the baby in the laying down position. You're going to have both hands, one under the navel and the tummy and one right above it. And you're going to do a sweeping motion going down and over the thigh. When they have a lot of gas, you want to use a gentle but firm touch. And when you're coming down, you want to make sure that you're rotating your hand and that there's always one of the hands over the belly. So if you have this one come down over the leg, this one's going to be on the belly. While this one goes over the leg, this one comes back up on the belly. And what this is doing is it's pushing down any fecal matter out of the intestines. The other F is called Fun Galore, legs up high. And this is one that's going to get more of the gas out. If the legs down low did not help to get all of the gas out, this one's going to go deeper into the tummy. So for this one, your hand is going to be right below the belly button, and you're going to do a sweep like this over the belly. The first thing you're going to do is you're going to lift the feet up with one hand, with one of your fingers separating the feet at the ankles. The other one, you're going to get your hand, you're going to touch right below the belly button, and you're going to do a sweep down and up with the feet up in the air. And what this is going to do is it's going to push more of the fecal matter, any air, any gases that are trapped in the belly, and it's going to push it out. That concludes the training for the infant massage for the tummy area. I hope you enjoyed it. I know little baby Emma enjoyed it. If you have any other questions, you can send me a private message on my Facebook. I have so many other techniques for the arms, the face, the back, the legs, as well as toddler massage. So if you have any questions, if you have any concerns, if you'd like me to do more of an in-person training, feel free to give me a call or contact me on Facebook. Have a great day.